an Aspen practice. But I'm going to stop sharing my screen so I can introduce my doctors here. We'll go ahead and start off with Dr. Alan Williams. If you could just kind of give us like a brief background about yourself and kind of what your Aspen journeys looked like so far.
Yeah, sure. Yeah, I'm Dr. Alan Williams, practice owner in Arkansas. I've been with Aspen since 2017, 2018. A 2016 graduate of UT though. First year out of dental school, was in a private practice. Had a great experience there, but eventually joined with Aspen just with the interest in ownership and multi-unit ownership. And so as I kind of developed through Aspen with starting as an associate and then to an MCD and eventually become an owner and eventually owning multiple practices there, it's each step, yeah, it's been great as far as getting the support and as again with the leadership around me, able to grow to where I wanted to be, which is a multi-practice owner. Again, I'm about 5 years out of school now, and overall had a great experience with Aspen. Pleased to be here, and yeah, fire your questions away. Glad to answer anything.
Yeah, guys. Like I said, down below where it says chat, you can submit your questions there anonymously or not. Your questions will not be held against you, I promise. But Dr. Hill Moses, do you want to share your background and kind of what your journeys look like so far? Oh, you're on mute.
All right, how about now? Better?
You're good.
Okay, awesome. Hey everyone, I'm Anna Hill Moses. I am an MCD, or a managing clinical director, dentist, whatever you want to call it, in Plant City, Florida, which is the winter strawberry capital of the world. So you've gotten strawberries in the winter, it's probably from Plant City, one of my patients. I graduated UT in 2019, and out of school, I knew I wanted to live in Tampa, so I was really open as far as what type of practice I looked at or would work at. I interviewed with both private and other DSOs, and I was just looking for a really, really awesome mentor, which is what I found in both Dr. Dickerson and Dr. Liu, who are my DOPs, or the dentist that owns the practice that I work in. And they're a husband-wife team, and they've been nothing short of awesome as far as mentorship. So yeah, that's me.
Awesome. Thank you, guys. So you guys are hearing, talking about ownership and this sort of thing. You're probably thinking like corporate dentistry, how is their ownership? So I actually work for Aspen Dental Management, which is the actual DSO, the dental support organization that supports all of the doctor-owned practices across the United States that are each, like I said, owned by dentists individually. So our job is just to really help them with anything that's non-clinical. So for example, this event here is a recruiting event, right? You guys get to meet Dr. Williams because he's looking for dentists in his practices. Anything that the practice needs to succeed, we try and help them with that. But anyways, I want to do the smallest amount of talking tonight. I want to let our doctors share their perspectives and their journey. So we'll go right into the first question. And I knew this was going to be a hot topic, but what offices are available with loan repayment? We'll let Dr. Williams take that one.
Yeah, so really for me, I'm recruiting not only to my offices that I own in Searcy and Cabot, but also Little Rock as well. So right now, yeah, most of all of them are available for loan repayment. So we've offered up to $200,000 in loan repayment over 4 years, and so that's available in really my Little Rock market as well as my personal offices. So I don't know as far as outside of this market, but I know that recruiting wise that they're pretty flexible or pretty open to whatever kind of feedback or market situations arise to make it more competitive to other people. So, but yeah, so for me, Little Rock, Arkansas, but basically, yeah, the suburbs around that, the smaller cities around that I own.
Good deal. And just, there's over 900 Aspen Dentals, guys, and to offer student loan repayment, it's not common. So this is a huge opportunity for anybody looking for that in the future. But we'll go right into the next question. Somebody asked before, what is the selection process look like if someone's interested in a 1-year residency program? I'm assuming this is a 4th-year student. If someone's interested in a residency, what does that look like, Dr. Williams?
Yeah, so yeah, typically like you would typically do, start applying to residency school as a 4th-year dental student. Yeah, get accepted. Make your choice on which way you want to go. Really, yeah, if you're looking at exploring the option of working with Aspen after that, then we want to, keep the lines of communication open. We certainly got places that have immediate needs, like in some of my practice, but also we know we're a growing organization. And so we typically always need more doctors. And so, if you're interested in working with us not just with me or with any Aspen offices, then we want to make sure we communicate well with you, make sure we provide you with any opportunities of places that are available. I mean, I'm partial to Arkansas because I need doctors there, but realistically, after you finish up your residency or whatever advanced training you're exploring, then we want to find a place that suits you, fits you well, and go from there.
Awesome. Dr. Hill Moses, did you look into any residency programs after school or?
No, in my 4th year, I knew I wanted to go right into practice, which is why I thought finding a really, really good mentor was my number one thing, because I knew that there would be times where I had questions, or maybe I wanted to dive deeper into oral surgery or whatever, procedure. And so I wanted to make sure I could find somebody that I could have easy and open communication with, as far as like, hey, I'm really proud of this. I want to brag about myself, as well as, oh my gosh, I got in over my head. What have I done? And I've had both those situations, and it's kind of nice. It's been really nice for me I think as a female, sometimes there's a little bit different situations that perhaps you can be perceived as from your patients. So it's been nice to have both Dr. Dickerson to go to, as well as his wife and co-owner, Dr. Liu.
Awesome. Awesome. Dr. Williams, did you look into a residency program after school?
I explored it a little bit. I was similar to Dr. Hill Moses. I pretty much said I had an idea of what I wanted to do. And I felt, fairly comfortable coming out of school. I certainly don't want to deter anybody from exploring those options, but I felt like I knew where I wanted to go, what I wanted to do. And again, I wanted to make sure I partnered myself with people that could provide good mentorship, so that, when those questions arise that you will have, when you find yourself in a situation you don't like, or want certainly somebody to or have another set of eyes on something, then it's good. It's comforting to have that support there around you to make sure that you're doing the right thing, make sure you're taking good care of people, make sure, you don't get in over your head. But certainly, I mean, we that's something we want to pride ourselves in here, myself, and I know that Dr. Hill Moses had as well, as making sure that we are supporting young dentists out of school, because it's a new world, right? And there's always going to be things that arise. There's questions that come up. There's challenges. There's, dentistry is a challenging thing. So we want to make sure that we provide you with that support. And realistically, we're mostly all in an office every day. We're there to support you. I don't see myself ever getting away too far from being right, side by side with at least mentoree dentist, and so that we can make sure that we're developing you as well as possible. And again, that's the goal.
Yeah. Mentorship is huge, right? That transition from student to actually getting into the practice. And that's something I definitely always stress when I'm talking to students, is make sure you have, something, a mentorship program that you're going into to prepare yourself. But the next question here is asking, what is the process for a D4 interested in Aspen, but graduating next May? Reach out to me and then I can get you connected with the right person. And then the next question coming up after that is, how long is Aspen's mentorship program? Dr. Hill Moses, you want to take that one first?
Absolutely. Yeah. I think maybe it might be a little bit different just based on who will be mentoring you. There is kind of a formal program, but for me, I wouldn't say it was super duper formal. Basically, I worked with Dr. Dickerson basically he owns 14 offices in the area. So whatever office he was going to that day, I was going to. So actually on my first day, he was opening a brand new office, which was like really fun to start and see. Initially, so we run 3 columns throughout our schedule. So there's a column with a bunch of production patients, so crowns, fillings, extractions. Then there's a column of new patients, so you're doing full comprehensive exams. And then there's a column with overflow, so maybe that's denture steps, or they're coming in for Invisalign, or they need a limited exam and they're in pain and you've seen them before. So he had me basically go into all the new patients with him and chart with him so I could see how he presented treatment to patients. Prior to us going into the room, we would go through all the x-rays, the health history, and he would basically have me come up with the treatment plan. And I think that's the hardest part out of dental school, is you need to come up with comprehensive care within the hour that the patient's in your office, right? And so we started by tackling that first, because I felt pretty comfortable with production, right? So he would have me, I would do fillings or crowns, extractions, things that I felt very comfortable with. And then it kind of did a role reversal where he was like charting for me and giving me tips and feedback on how to present treatment to patients, because maybe they don't want to hear the news that they're completely unaware that they need a full extraction and dentures. So mine was semi-informal, but at the same time, I feel like there was some structure to it in that we really focused in on those new patients. And then once I nailed that, I said, okay, this is where I feel weak. For example, after a year, I said, I still feel like I could improve on full mouth extractions, improve the patient experience, and be more efficient. And so Dr. Dickerson spent a week in my office, and that's all I booked. And he did every surgery with me and gave me different tips and tricks, which was really, really awesome. So I kind of touch base with them regularly. I don't think the mentorship ever ends.
Yeah, exactly. You always have connections and you build a network over time. But Dr. Williams, what is, how long is the mentorship program for you?
Yeah, just kind of follow what Dr. Hill Moses was saying. Yeah, really, hopefully it never ends, right? Hopefully we build relationships with you, and we're there with you, from beginning of your career from then on. There is kind of a formal onboarding. I think maybe that's what people are asking about, to kind of get people acclimated to practice, and that's typically a couple months. And we want to make sure we take our time with that. Make sure we get you acclimated to the environment, the way we schedule, the way we the workflow of our offices, and we really want to take our time, make sure we get you comfortable in the practice. We want to make sure you're comfortable doing good dentistry, make sure you're comfortable providing good care before we just turn you loose. And so usually that looks like similar to Dr. Hill Moses said, is the owner doctor spending a lot of time, just in the same operatory with you, and he's going in with new patients. Sometimes I spend a lot of time with extractions with my new doctors, because I think that's usually an opportunity for them as well. And so, sometimes I'm over there assisting you, and we talk about the case, and we looking at radiographs, and we're talking about strategies and things to do, and again, like she was saying, comprehensively treatment planning stuff that's predictable. I think that's one of the big things that people coming right out of school is, you kind of look at this tooth, you can do a bunch of different things with it, but at the end of the day, it's got to be something that's really predictable, that we can do 9 times out of 9, and turn around and the patient experience that success. And again, so those are kind of things that we hopefully would continue to develop you through from here on. And if, again, like Dr. Hill Moses said, when you look up and you say, hey, this is an opportunity for me, this is something that I'm struggling with, I'd like to get some feedback or your input on it, and that's what we're here for, is to cover you up with any kind of support we can provide to make you a better clinician or a better leader in the practice, or whatever the case is. But just we're here for you. We're here, our phones are available, we're usually texting or calling or constantly in contact with our mentees, because we build a relationship, and it makes this this dentistry thing go a lot smoother. So we really pride ourselves in that.
Awesome answers, guys. Thank you. But yeah, so like to answer your question with the number, it's usually like a month. 4 weeks is kind of like the onboarding process, but like they both said, the mentorship never ends, right? If you need help, you always have access to resources, whether it's somebody or CE or whatever you need. But this question is directed towards Dr. Williams. Somebody's asking, are you looking to hire immediately, or are you open to students graduating in May of 2022?
Yeah, both. I do have some immediate needs, but yes, I'm also always recruiting because we are growing. And so, yeah, we know pretty certainly that we're going to have a need and when patients graduating in 2022. And so, yeah, so we want to make sure we get started on that process. I think it's good too that you have more time you can research and spend time and look at our models or maybe come to the practice. I always encourage people to do that. If you have questions, you just want to show up at the practice one day and see what a day looks like working in our offices. And stuff like that is stuff that usually helps you make a better decision. But yeah, to answer your question, yeah, we're hiring immediately, but also yeah, look for the future as well. We know we're going to need more doctors, and so yeah, we'll be hiring in next year as well.
Awesome. Thank you. All right, so we'll just jump right into the next question. Somebody's asking Dr. Hill Moses, what are your future plans with dentistry?
Sure. So right now, I've really been toying with my head of, I'm in a location that I don't want to move from. So that basically, I want to stay within general dentistry without a doubt. So prior to dental school, I actually taught high school chemistry. And I love teaching. And I'm in an office where I have an associate some days a week. And right now it's somebody who actually has more experience than I do. But I just got a new grad. So I'm looking forward to hopefully, mentoring her and really honing in on those skills and possibly partnering with the Dickersons. But I'm not exactly positive. We'll see. That idea is there for sure. I just, have questions for them. And right now they have one partner. And so I'm meeting with her to kind of see how she's gone from that transition of being an MCD to a partner. Yeah.
Awesome. Yeah, so what she's referring to is, exactly what she's saying is partnering with the practice owner. So if managing clinical director is interested in partnership with an owner, they can, voice themselves to the owner, and that's a conversation you can have. And most of I don't ever think a practice owner has wanted to turn away a partner for the most part. But that's a great question, and I'm going to direct it at you, Dr. Williams, as well. What are your future plans with dentistry?
Yeah, like for me, when I got with Aspen, my main goal was practice ownership. I really love the practice model and getting the support from a service organization that would allow me to focus on dentistry, focus on the things that I was trained to do and hopefully was better at than maybe trained to run a practice. Now, certainly, they will educate you as much as you want to and to allow you to be as involved as you want. I mean, I have complete control over every aspect of my practice. I mean, I can literally change the location. I change the hours. I can change anything that can be changed in any dental practice. And they'll help me make those decisions, whether it's right or not. And so that gives me support, gives me information, and they benefit when I do well. And so they are 100% supportive of me and finding ways to be successful. And again, when when I'm successful, everybody wins. And so so for me, when I got with Aspen it is a partnership that worked well. I love the idea of being able to grow and mentor more doctors and kind of see myself expand a little bit more as far as the number of offices. Really though, I don't never see myself not practicing dentistry. I really love what I do. Enjoy coming to work. And so yeah, again, want to mentor more doctors, want to continue to grow, want to just see how well we can support and help people around Arkansas.
Awesome. These are great questions, guys. Keep them coming. But I am going to say you need to ask some more harder questions, push these guys a little bit. But we're going to dive right into the next one. Somebody's asking, what does the perfect associate look like to you? I think that's a good question. Dr. Hill Moses, you want to take that one first?
Yeah, I've worked with a bunch of different associates, and I think it's just you need to exude positivity. Dentistry can be hard sometimes and pretty humbling, and I think it's just attitude. You know, if you come in with positive attitude, you like what you're doing, you want to be at work, that's awesome. And then you want to have a learning culture. Dentistry, I think Dr. Williams was mentioning before, we could all look at a tooth and come up with like 9 different treatment plans for it. And so one of my when I first started, I actually worked with 2 other doctors, and it would be so fun because we would just sit in our office and all look at X-rays because we didn't know who was going to go into that new patient exam, and we'd all have different treatment plans, and we'd talk about like what was best and why or whatever. So that was really really fun. So definitely positivity and being able to learn.
Awesome. Dr. Williams, what do you think?
Yeah, I mean, not to kind of echo what she said, but things that I talk about with my team, not just associates, but just all the members of my team, is that 2 things that you can control every day. It's your attitude and your work ethic, and it's so much of your day will either go well or go badly based off your attitude. The patients feed off that. They can see whether you enjoy your job. They can see whether that you enjoy what you do. You're glad to be there. They can see whether you're hating your life and not wanting to be there. And usually it just leads to more anxiety, then throwing up more roadblocks for you, making it more challenging for your day. And so again, your attitude's a big thing. And certainly, yeah, work ethic, in dentistry, and the only way we generate revenue is by using these 2 hands. And so, an associate, you have to, yeah, there is some work required. Now, again, I say that lightly is because, we're associates, we really, what I look for as my associates, number one is, are they taking good care of the patient? Like, are they doing things the right way? I want to make sure that they're people that are assets in practice. I've been blessed to have great associates. The other thing too is, and sometimes I see this, especially in associates, is do they want to grow? And if that's the case, then I want to look and say, hey, yeah, they're a great associate, but hey, do they want to be an MCD one day? And so we can already start that development of like, hey, start thinking not only like an associate, but hey, what if this was your practice? What if you're here by yourself? What would you do in these situations? And so it's a great way to kind of say, hey, starting off, yeah, I'm just getting comfortable and learning dentistry and don't have the responsibilities of the full, MCD role, but also like, hey, if that's something I'm interested in, let's think about that while an owner's here and MCD's here, and so that you can grow and develop. And but again, yeah, it's again, I think like Dr. Hill Moses said, is that your disposition when you walk in and your ability to take care of patients is really what we ask of our associates.
Awesome. Thank you guys. Yeah, I mean, coachability, ability to learn, that's something that I hear from various practice owners all the time. Awesome. Thank you guys. Great question. So somebody's asking, what did your path to ownership look like, Dr. Williams?
Yeah, absolutely. So again, right when I got out of dental school, I did spend a year in private practice. I actually had a great experience in private practice. Worked in a practice outside of Dallas, Texas, and again had some good mentor doctors that helped kind of show me things that have made them successful, helped kind of develop me to probably the doctor I am today. But from there, I was moving a little bit. My wife's job was traveling a little bit, and right at that point, for me, I was a bit able to move with her, and so when we moved again, I was looking at again exploring the Aspen option. Their ownership model intrigued me some, and I really kind of liked the way it was designed and set up. And so when we moved again and had to change jobs, I looked at the Aspen, started working with a doctor that was an owner at that time. And again, he kind of carried me a lot further as far as development. Really kind of kept showing me the way. And again, it was a relatively shorter transition from there. I've been out of school 2 years there now, and slowly transitioned to an MCD within a year, and then from there expressed my desire, like, hey, this is something I really like. This partnership's working well. They were pleased with my leadership in the practice, as well as they were interested in me being an owner. And so yeah, we looked at a map and said, hey, Doc, where do you want to go? Or what's available, and how far do you want to grow, and those kind of things. We kind of ended up in Arkansas, but really from an associate to ownership was just a couple of years. So I was owning in 2018. So again, the ownership process is pretty smooth. It's a process that they want you to be successful in. So they're not gonna let you buy a practice and let you sink because again, they're not successful in that manner. So each person's a little bit different though. Some people jump in and they need a little bit more time, and there's nothing wrong with that. They want to make sure that you're going to be successful, make sure you have the support you need. And again, some might take years, may take just a few months, and you kind of climb quickly. So teach their own.
Awesome. Dr. Hill Moses, so I'm going to change the wording of the question. What did your path to MCD look like? And MCD stands for, again, Managing Clinical Director, and it just means like lead dentist. But yeah, what did your path look like?
Sure. So I started as an associate in one of their busiest offices. We were seeing probably 12 new patients a day. So I got a lot of experience there. And then in my first year out of school, COVID hit and we shut down for about 2 months because the government made us. And after that, we decided that, dentistry was closed for a long time. We needed to expand care. So our offices were actually open on Saturdays as well, but they had us doctors only work 4 days a week. So that is when I really started to be on my own. And I worked in 2 days in one office and 2 days in another office. And I was surprised because I love being with peers, but I rocked it out by myself. And so one of the dentists was leaving and he had a gem of an office, which is where I am now. It's my little gem. And the Dickersons basically said, hey, we're giving you this opportunity, and another associate's really interested in being the MCD there. So they gave us a fair game of both having that opportunity of leading that office. And, my personality fit well there with the staff and the team, and we meshed well. And so that's how I got into Plant City. But I mean, they also help you out with leadership of your staff and your employees as well. Dr. Williams kind of touched on you can be as involved or as uninvolved as you want as far as your own autonomy within your practice. Of course, the autonomy of the clinical is completely you. But as far as like the office management and stuff, and I love that part. So I'm very involved. And so that has been kind of fun to dive into as an MCD, as I get a lot more say in that.
Awesome. Yeah, guys. So as she said, it's kind of up to you how much you want to be involved in the business. Some people love it. Some people just want to take care of people, and that's it. That's perfectly fine. But we're going to dive right into the next question. It's a good one. What was the hardest thing for you to adjust to when you started at a practice? I'm guessing out of school. Dr. Williams, you want to take that one first?
Yeah, you bet. Yeah, I think the most challenging thing, and I would say for most all dentists, but for me in particular, is learning to time manage, maybe work multiple chairs. I know Dr. Hill Moses can probably attest this too. Is as an associate, we really get you in. We kind of fill you a column of just production things, and really don't intend for you to run the office. And you're not supposed to be prepared to see as many patients as her or I am, just because we've been doing it a little bit longer. But learning how to manage your time, learning how to be efficient in the practice, learn how to work multiple chairs, and again, those are just skills that you acquire, and of course your clinical skills are starting to go sharpen. You're going to become a lot more efficient just in all procedures. Certainly, the more you do, but I think just managing that time is a really difficult skill to kind of master early on. It can feel kind of overwhelming at first, and so that's really why we want to make sure we usually start people as an associate, just so it's an easier transition. Like we don't want to throw you in the deep end. We want to make sure you're successful, and so I think that's probably the toughest skill. Another really tough, I think, skill to really accomplish, we kind of talked about this earlier, but comprehensively treatment planning and treatment planning, to success and predictable success. I think those are things that a lot of dentists, as we come out, we know all the options available for the tooth. But like you gotta evaluate the patient, right? If they haven't been the dentist in 10 years and probably not coming back for 10 more, like that affects your what your treatment of choice is going to be. And so you kind of have to play a lot of factors in your head to come up with the best option for them. But again, those are two things I think that are most young dentists that are in my practice have struggled with, but things that they accomplish or learn to do well. And I think that it's just something you gotta do. You gotta take time. You gotta watch how, Dr. Hill, Moses, and myself kind of navigate through the multiple chair practice, and that's a skill that will come to you.
Awesome. Yeah, I've heard that pretty often. Managing multiple chairs is something that takes a little bit of time. But Dr. Hill Moses, what about you? What was something that was difficult for you when you first started?
Yeah, I think 100% time management, because you're trying to do, in school you have 4 hours to do one filling, and then all of a sudden you're like, I have to do 4 fillings in 1 hour. It's completely reversed. So you just want to still make sure that you're providing quality care while being very efficient with your time. So still to this day, every now and then I'll do my 4 fillings in an hour. Maybe they're 4-2 class 2s. And then I ask my dental assistant, hey, can you take an x-ray of that? Because I want to make sure I'm still checking myself to make sure I do quality care, and then, yeah, treatment planning. And lastly, I think there are issues that sometimes can arise, whether you're in a private practice, you're in a DSO, it does not matter the setting, but there can be issues amongst your staff every now and then. And they're all going to come to you, and managing people can be difficult. So that's something that I'm still learning and growing in every single day. And I think my biggest thing I've learned is people just want to be heard. Sometimes you don't even need to fix the problem. You just need to listen to somebody. But that's more on like the team management aspect. Yeah.
Awesome. Thank you guys. Another great question, especially since Dr. Williams just came back from this training course. Are there opportunities to learn to place implants? So Dr. Williams, I'll let you take that one and elaborate.
Yeah, you bet. Yeah. That's something, that we want to certainly make sure we get you trained well with first. I mean, that's something that, there's a lot of places you can go and you can start placing implants immediately, to each their own on that. But as far as our perspective on that is we want to make sure that you're trained well before you do it. We want to make sure that we're providing good service to patients. And so, again, we want to get you trained. That's something that's a big part of our business. And so we want, if you're going to be a doctor in our practice, we want you to be trained well in that. So we've partnered with some training courses outside of our Aspen network that we train a lot of our doctors with. And again, this came back from a great course, and just think a lot of implants, really get a lot of in-depth knowledge and a lot of surgical experience, which is important with some really qualified people. So again, we've got a great support staff, and implants led by Dr. Wall, prosthodontist, is really, really well renowned. And again, but not just implants. I know implants is kind of a hot object right now, as well as clear aligners. So just same thing with Invisalign. If you're going to be a doctor in our practice, and we'd love to get you trained on that, get you up to speed, make sure that you're comfortable doing those things, and just more development, more mentorship, more resources for you to be successful.
Awesome. So we do have a whole learning and development team that's strictly focused on, developing the mentorship programs and offering the multiple CE courses. Like the implant training course with Dr. Sandeep Rawal just recently came out in, February of 2020? Yeah, the infamous 2020. Dr. Hill Moses, did you take the implant training course, or is there anything you want to add on that?
Yeah, I've done the pre-work so far. There's like one more online encounter thing I need to do. But I know in my offices, we have actually both an endodontist as well as an oral surgeon that rotates through, which is nice. Dr. Dickerson, our owner, places a lot of implants, but their goal is to get every single MCD trained in that. And then once their MCDs are trained, they want to go ahead and get their associates trained. And I think the biggest thing here is just growth. If associates are showing that they want to grow, then they'll be trained, once they're sufficient or show that they're really great at all the bread and butter of dentistry. But yeah, I mean, same thing the clear aligner training is super duper awesome. As far as restoring implants, though, I do that every single day. A lot of cool all-on-4 cases. I think it's just making sure that you're really proficient with your surgery skills before getting that implant training so that you're ready for it. Yeah.
Awesome. Thank you. Yeah, clear aligners. We actually just launched a new clear aligner called Motto, which Aspen has their own in-house clear aligner, which is pretty cool. And I believe it's available as of like today, if I'm not wrong, Dr. Williams. But we'll just jump right into the next question. But how many patients do you see per day, and how many do your associates see per day? Dr. Williams, you want to take that one first?
Yeah, sure. Yeah, and that's kind of a rolling question, not to mislead or deter, and really a majority of the patients I see per day are actually going to be like overflow patients that Dr. Hilma was referring to earlier that are short things like denture adjustments, soft liners, denture steps, could be impressions, stuff like that. So there's, I probably see more of those patients than any other patients throughout the day. And then my office typically sees 7 or 8 new patients a day as well. For me, production patients a day, I'll have, depending on the day, depending on the procedure, I'll have 4 or 5 of those, sometimes 6. But I typically try to do bigger procedures in my production chair, so I typically don't see quite as many production patients there. But overall, my office sees about 30, 35 patients a day. And that's hygiene as well as associate. And so associate typically sees, 4, 5, 6 patients a day, maybe. So
Cool. Dr. Hill-Moses, what about you? And this, guys, this varies, geographically, obviously. So the patient demographic, how many patients can vary, but sorry, go ahead.
Yeah, absolutely. So I've had a really unique opportunity to work in 14 different offices because after COVID, I served as a float associate, and there were offices that were really slow that I could kill some time in. And there were offices where I could not catch my breath. And right now, I think once you become an MCD, perhaps you have a little bit more control over that. I'm a busybody. I love to be busy. By myself, I'm probably seeing anywhere from 20 to 35 patients per day. But that also includes the hygiene checks. There's some that are assistant only, right? So certain things that I maybe don't need to go in for. But in my production, basically anywhere from 5 to 7 patients. And then a lot of those other patients are just quick things. My associate, typically I just book a column of production for her, and it's based on her preferences. So, we have a little print off. We know that she likes 90 minutes for a buildup and crown. She can do 4 fillings in an hour. If it's 6 fillings, she wants 90 minutes. So we really try and tailor it towards what her preferences are. And she likes restorative a lot. So I know that she loves that. I give her mainly restorative procedures. So it really just depends, I guess.
Yeah, absolutely. Awesome. Thank you. So this is a good question, especially since we kind of touched on it briefly. Is there any type of specialty support? So Dr. Williams, do you want to touch on that?
yeah, absolutely. I have an oral surgeon that services my office as well. It's an oral surgeon there that travels around through our office in Arkansas, but also has a private practice as well in this area. So he's really great support. And again, anything as far as complex procedure, medical history things, extractions, implants, stuff like that. Yeah, they're game for. Yeah, if you get yourself in a bind and I can't get you out, then we'll get him to get you out. But typically that's not the case. But it's great support. And not just the support that people come in and treat your patients, but also just another person to talk to, another person to help mentor, you, or another person to bounce ideas off of. So I love having that specialty support that just has another set of eyes and maybe a different perspective from me, that looks at patients or certain cases a little bit different way. So again, I'd love to have an endodontist specialty support, but see if we can get recruiting on that. Had a difficulty time, but yeah, we'd love to have an endodontist, but we have oral surgery support right now.
Awesome. Yeah. So guys, the offices vary in terms of specialty support. Obviously with there being a new office opening every 4 days, and I think we're almost at 900 offices, you know, finding specialists is getting harder and harder because they cover just a certain region of offices. Oh, looks like we lost Dr. Hill Moses. Hopefully she'll be back on, but that's all right. We'll go right into the next question. Somebody's asking, how do you own multiple practices? Fair enough. So Dr. Williams.
Yeah. Yeah, good question. Well, yeah, quite simply is yes. Yeah, it's offices in my area that are unknown that Aspen has partnered with me to own. And so how does that work, right? Or why would they want to own? Why would they want me to own multiple practices? That's always a question I get. Like, why would Aspen want you to own multiple practices? And the answer is quite simple as well, is that they know that owned practices generate a lot more revenue than unowned practices because there's a vested interest in that practice. And so again, they benefit when I benefit, or they're successful when I'm successful. And so again, they love practices of their own because again, their bottom line increases as well as mine. How do I do it though? It's difficult. Yeah, I spend most of my time in one of my practices just because of I'm needing doctors. So for this event particularly, right, I need doctors there so that I can float around a little bit more. But in an ideal situation, like I would be splitting my time or rotating my time through each practice to help develop my team, mentor my doctors, make sure that I'm supporting them in every way, and then certainly to take on bigger cases, more challenging things that they don't want to. Hope that answers your question. If not, certainly shoot a follow up there. I'll be glad to dig in a little bit more.
Awesome. No, that's great. And those of you wondering, the whole practice ownership program was set up by, us to give our doctors skin in the game. When it's your baby, when it's yours, you're going to treat it like so. And I think that's awesome that they're doing that, and giving you guys that opportunity to do that is great. So here's a more simple question. What are my work hours? So also a good question to ask.
And also depends office by office, right? I'm like right now I have an office that works 7 to 5. They like those hours. That works well with the team. The doctor particularly usually makes those decisions that is there. But my office another office I have works 7:30 to 5:30 most days. We do typically have one late day a week, meaning a day that we go in a little bit later and stay open a little later. And the idea for that is to accommodate patients that are working that don't typically have a schedule they can get away from. And so try to find a way to make care accessible to them. But to answer your question, I think if I was guessing, most practices are about 7 or 7:30 to 5:30 ish or so. And Friday's a half a day for me. I work usually one Saturday a month. I don't ask my associates usually to work that. I usually work that myself. And then the one late day, which our late day is Thursday. But again, each office is a little bit different. Some offices actually have expanded hours, like I think Dr. Hill Moses referred to earlier. And so where they'll have 3 or 4 doctors in the practice, and sometimes their hours are 7 to 7. And I worked in one of those practices before I was an owner, and I actually loved that arrangement. We'd alternate either early or late shift, and I'd go in at 7 and leave at 4. And so I actually was working less hours throughout the week. Had 2 doctors there most of the time, and so I was supported well as an associate or MTD. And then at the end of the day, we'd split Fridays. And so I'd work 4, sometimes 5 days a week, but it was less clinical hours than I actually do now. So depends on your office, depends on the area, depends on the demand. So if the demand's really high and we have doctors there to support the practices, and usually we're there and say, hey, we try to help more people, we're all for it.
Awesome. Thank you. All right, this is another good question. I think we touched on it briefly, but the associates in your practices, what kind of procedures do they do for the most part?
Yeah, starting out simple things, and that's not only just to make them comfortable, but to make sure that I can evaluate their ability to do things. But really though, we want to develop you. So again, people tend to get really good at the things they enjoy. And from my particular case, I enjoy extraction. So I do a lot of them. I typically do most of them in our practice just because I'm probably more efficient than the average dentist with them, and feel comfortable doing those. But again, we want to cater our schedules, or cater our, your schedules to your preferences, because we know that, if you do things you enjoy, you're going to do them well and you're going to get better at them. Some people love a variety. So some people say, hey, I want to learn as much about all these things. Or like Dr. Hill Moses says, she has an associate that loves restorative. They just love doing crown and bridge, and they love doing, restorative fillings. And so, yeah, if that's the case, then yeah, we want to cater to your strengths. Cause again, you know, when you're happy, yeah, then usually everybody's happy and we're all successful.
Awesome. Dr. Hill Moses, are you there?
Hey, yeah.
Okay, cool. We can hear you. So the question just was, what kind of procedures does an associate typically see? So do you want to?
Sure. Yeah, I think in the beginning, it's just kind of what you're more comfortable with, and communicating that. And I mean, if you're fresh out of school, you're probably going to need more time. And, you know, the whole idea is to maybe make sure that you're giving your patient the very best care that you can. But also, you know, a unique aspect to Aspen is that we have a denture lab within our own practice. So we do get a lot of patients who need and want dentures. So as an associate, I definitely wanted to nail all of the denture steps and make sure. I remember one week I told Dr. Dickerson, I said, Dr. D, all I want to do is make sure every single wax bite's perfect so that when we go to the wax try, it's about a 5-minute appointment. And so I just focused in on that for like a whole week, was nailing the wax bite. Because then it just makes that next appointment really quick and easy. Occlusion's on and you're ready to rock and roll. The associate I have right now, she like hates extractions. So I don't really give her extractions unless they're perio involved, and that's what she loves. So I'm totally okay with that, because I love extractions. And you know, you see some production, but I think with overflow doing, you know, if you're going to be the one doing an immediate partial or an immediate denture, it's kind of important that you see the patient throughout that process. So you know what their original bite looks like, you know what they're expecting when they walk into that room to have that surgery. That's probably a pretty big deal to them.
Absolutely. Awesome. Thank you guys. So we're going to go right into the next question. So this is a good question. If you went to dental school again, what would you do differently? Dr. Hill Moses, you want to take that one first?
Yeah. I think sometimes I would either get like obsessively into one thing or I'd rush through it. And I wish that I kind of had a more happy medium throughout dental school of just being generally interested in everything, and taking the time to ask the questions when I was really uncertain, because I thought I didn't want my clinical instructors to think I was dumb as a D4, because I was like, I've done this a million times. So sometimes I feel like I didn't ask enough questions when I should have, and also just, you know, slow down and enjoy it.
Awesome. Awesome. And your involvement at UT in terms of organizations, you were pretty busy throughout your years.
Oh yeah, I was very involved with ASDA, which was super duper awesome. I would 100% do it all again. That is one of my favorite aspects of dental school, and I think that is what has really groomed me to become a really, really great leader within my office.
Awesome. Dr. Williams, how about you? If you went back to old University of Tennessee, what would you do differently?
Yeah, you know, I don't know. I had a pretty good experience there. I would say this, you know, I would probably tend to try not to listen to a lot of influence from people that don't necessarily know what they're talking about. I say that with intent, like, yeah, I had a lot of classmates, you know, that either had parents or dentists or family and dentists. They seem to have it all figured out. And, you know, you look up now and a few years later, sometimes you wonder like what those guys are doing, because yeah, they were kind of erratic. But I think that, you know, even from faculty, you find people that you really like, that really fit you, that you're compatible well with. You find ways to really lean into those people and really make sure you use those as good resources. And people that are, there's also people that are kind of pushing certain, you know, agendas. I know we had certain faculty that love certain procedures, or certain, you know, if it was a CAD/CAM crown or something like that, you know, and you know, take what you can from it, but you also, some people are just kind of hung up on their own motivations. And so yeah, just kind of try to pick and choose, cherry pick from faculty that you get little nuggets of information that will be beneficial to you. But just kind of find your own way there as far as what makes sense to you, what the vision you have for dentistry, or how you want to perform, or how you want to treat patients. And really kind of lean into people that kind of align themselves with you on that, and kind of avoid the people that are maybe spewing information that's completely bogus. So
I hear you.
I'll leave it at that.
All right. So this is a question that's typically always asked, and I love hearing the perspectives or the, your guys' answers, but what have you liked the most and the least about Aspen so far since your journey? And I'll let Dr. Hill Moses start.
Yeah, I think I love that there's just so much support. So our oral surgeon is actually moving to New York. So my office is going to be without an oral surgeon for a little while. But our office is 20 minutes from another office that is serviced, or not serviced, I don't know what the right word is. Another oral surgeon goes there. And I just asked my regional manager, I said, hey, can you give me that oral surgeon's phone number? And he did. And I sent that oral surgeon a really long text about a comprehensive case I'm working on today. And he immediately called me back, and we'd never met. So it's just super awesome that he was like willing to help out another dentist that he had never met before. And, we sat and had a really good conversation about that patient. So that was awesome. As far as my least favorite thing, I think as of right now, as an MCD, I don't necessarily have complete autonomy over my hours. So the Dickersons do decide when my office is opened and closed. But we did just, we have a late day on Thursdays, so we're open late. We work 10 a.m. to 8 p.m. and that was really late. And I expressed to them, hey, my staff is not happy with these hours, and I have to work at it a little bit, but we just changed it 9 to 7. So maybe that's my least favorite thing, but I did get it to change, so soon it won't be.
Yeah, that's why relationships are important. So Dr. Williams, how about you? So your favorite thing about Aspen, I guess your least favorite.
My favorite thing, I think really just growth potential. I walk in the door, 3 or 4 years ago, and you look at like, hey, the sky's the limit. And it really is. You walk in and start as an associate, and the growth path, for me was quick. But for most people it is. You look up a few years and you're an MCD or a partner or an owner or whatever the case is, and you're blown away by how quickly you've grown and developed, and how much how far you've come in such a short amount of time. And again, I had the idea of wanting to own multiple practices when I got with Aspen, and again, I was able to make that happen, and still growing, still enjoying it. As far as my least favorite thing, I don't know. Like my practice, I hate my parking lot. It's people are like, I don't know if they don't know how to drive or what, but like the parking spaces are not aligned correctly or something, but they're always like coming back into people. My mailbox has been knocked over 4 times. So I don't know if I could get them to change my parking lot or something, I'd probably have less stress on that. But other than that, I mean, really, like, like we were talking about earlier, as an owner, like if there's things I don't like literally I could go out there and I could get a hire construction crew and we could change the parking lot. That's something that we could do. But I could change anything that I don't like. And so as an owner, the good thing about that is I got to look myself in the mirror and go, hey, if I don't like something, like I need to evaluate if it's something I just don't like personally, if it's something like we're not doing well or something we can improve on. And so with that being said, again, if I don't like something, I have to find my own way to fix it, with partnering up with Aspen and whatnot. But, again, I had the ability to do that. And they give me the information that allows me to be successful, make good decisions. So I really don't have too many complaints as far as that.
Cool. Good deal. I saw some people have joined in a little bit later. Those of you that don't know, there's a chat box at the bottom where you can submit your questions. we have just about like 5 more minutes or so. We want to be respectful of our doctor's time, but we'll go right into the next question. This one's directed towards you, Dr. Williams, but did becoming a practice owner reach your expectations?
Yeah, absolutely. I'll again, the way they sell the practice ownership program, I'm sure if you've been exploring Aspen at all, like you've talked to the recruiter about ownership, and they'll kind of tell you all these things. You're like, yeah, those numbers really, they make that kind of money, or did they, is it that easy? And realistically, it is. Like, it's smooth, and maybe I hopefully touched on earlier is that they want you to be successful, so they're going to make sure your practice is profitable before they even let you sign the papers on it, and they're going to help you get it there. So if it's not, yeah, they're going to support you in whatever way they can to get you that success you need, so you can be successful financially as well as as patient care wise. So yeah, ownership has been smooth. One office is pretty easy to manage because you're there all the time, right? So you got your hand in it every day. But 2 offices, 3 offices, you start getting to a couple offices when it becomes more challenging because you can't be there all the time, right? So that's the challenge there. But it's a challenge that I enjoy. It's a challenge that I welcome on. But the ownership model, yeah, absolutely. Like if I want to close my office, I can close my office. It's not financially beneficial for me to do that, as you can imagine. But so yeah, the freedom to do, you treat it as your own practice when you become an owner is absolutely true. Like it is your practice, it's yours. Yeah. So you're financially responsible for it, and financially responsible for paying your employees, as well as, yeah, the windfalls from when you're successful. So it's good.
Awesome. And then Dr. Hill Moses, I'm going to obviously change the question a little bit, but has being an MCD reached your expectations, being a lead dentist?
Yeah, absolutely. Sorry, guys, I had some computer trouble, but I'm back now.
Yeah.
Yeah, I think even as an MCD, you have quite a bit of autonomy. I am so personal. I just like love the management of dentistry as well as doing it. And so, with my office manager, I'm left-handed. So she's my left-handed girl. Or she's my left hand. I don't know what I'm trying to say. And having a really awesome relationship with her so that we could build the front to exactly how I envision it. So maybe, Aspen gives you guidelines and recommendations of, hey, these things really work well for other offices because there's 900 other offices that are running, and there has to be people who are doing things better than you. But working with her to kind of groom the whole front office has been super duper fun as an MCD, which is maybe a little bit different. I think also I did this awesome surgery this week that I'm just so proud of. There was huge tori and I removed them myself. And I can't imagine that I would be doing that 2 years out of school. And I think it's truly 100% because of the mentorship that I received. And I felt completely confident in what I was doing, that, I was treating the patient with best care. And for best care, I could do that. So that's been super awesome as well, is just seeing my own growth within my own clinical skills.
Awesome. Thank you. These have been great questions, guys. And I'm surprised it's taken this long for somebody to ask this, but somebody's asking, what does the compensation look like? Which one of you want to take it first? I'll let you guys, who feels more comfortable sharing.
Yeah, I'll jump in. Yeah, because that seems like something that's usually getting asked by me.
Okay.
Yeah, I mean, so typically you have different tiers there. So you have an associate, we've kind of talked about, or an MCD. Compensation is a little bit different for each one. As an associate, yeah, you come in and you're really just you're a support to the practice, especially the MCD. You typically work mostly your production chair. You certainly can help out in some of the other chairs if you're available, but not as much as asked of you. You're not really having to worry too much about the overall running of the practice outside of the operatories you're working in, and so not as much responsibility as asked of you. And so really we provide you with a strong daily rate. We again, my area, we try to be at market average or above. And then you're also incentivized or profit share based on the profitability of the practice. And so those numbers vary as well. I think recruiting wise, they can help you kind of lay that out so you can kind of see the different tiers. But that number, that profit sharing number, is a range, and that range is based off the patient satisfaction from the practice, man. That the happier your patients are, the more you get paid. And so we think that's a good model, is that if you're providing good care, you're taking good care of your patients, they're happy when they leave, they're happy with the treatment they're receiving, then you should get paid more for that. And in turn, it's good for the business as well. As an MCD, again, same setup as far as daily rate, strong daily rate, but also you get a lot bigger profit sharing because you have to shoulder a lot more responsibilities. Just like Dr. Hill Moses was saying, she's partnering with the OM every day and handling the front, and then problems with, if there is employee problems, trying to mitigate those, and really trying to really be a leader in the overall practice, right? Be a president, be a driver, make sure you're really being the person that is everybody comes to, and you're responsible for it all underneath you. So again, it takes, clinically you got to be competent to do that, but also it really kind of develop you as a leader and as a leader in the practice. It really helps support everybody there. And so again, with more responsibility comes with more pay. So
Yeah. Dr. Hill Moses, is there anything you'd like to add on to the compensation model?
Yeah, I think I'm not really a numbers person. So I was like, okay, wait, how we're incentivized? I didn't really understand it until I really was working and then saw the numbers. When I interviewed, pretty much they showed me like you can get a summary of your day before, which is kind of nice to look at. And did not really understand it, but now I look at it every day. And the pay is, it's based on how hard you work. So if you want to make more money, then you work harder, just like in a private practice, same thing. So there's really not the biggest difference, except that fresh out of school, you're just going to be slower at procedures because that's the nature of dentistry. So you do have a daily rate, which is a nice little cushion.
Yeah, absolutely. And I'm just going to piggyback off that just quickly to give an overall summary. So you have, like they said, the daily rate that's given to you, it's paid to you biweekly. And you also have the profit share. So I would say the daily rate's kind of like your base salary. And then the profit share is the bonuses that you get at the end of every month. But let's say, you make $10,000 at the end of the month from just your daily rate, right? And then your profit share, the office profits $12,000. There's a difference of $2,000 there. And that would be your bonus at the end of the month if the office is, profitable, like I said. And that profit share is including the whole office. So you as a dentist, the other dentists in the office, the specialty, so endodontists and oral surgeons if they're there, hygiene. So everybody's forced to kind of work together as a team collectively to make sure the patient satisfaction scores are up, to make sure everybody has the same incentive in the office. And again, that encourages teamwork, encourages to making sure the patient is put first at all times. And I think it's super cool. Like when I first learned about it, it's pretty confusing, but it makes the most sense. But we are at the top of the hour. So again, I want to be respectful of our doctor's time. Thank you guys for hopping on. Is there anything in closing you guys would like to say, Dr. Williams, just as a kind of a goodbye?
Yeah, no, I've enjoyed the questions. Enjoyed, getting to hear him speak, to those questions, and really, like he was saying, there's a lot of information out there. There's a lot of people that you can call to kind of get to learn more about Aspen. But I would encourage you to, a lot of y'all are at UT, so right across the river from me. If you're really interested, come visit, come to the practice. Like you can schedule. Yeah, I'm glad to give you my number if that's something that Sammy has that, or if you just want to stop in one day and kind of see how it goes. Again, and you'll see, you kind of see the patients that come in and out, the type of patient we see, the flow of the practice, the staff, all that fun stuff, the staffing model in the practice, the lab, all those things that you probably have questions about or want to see how they work in action. You see how the day goes, right? Or they run behind. Is it frantic or is it just a smooth operating procedure, daily procedure for them? So those are things I'd love to visit. Yeah, you're welcome to visit any of my practices. So reach out. Glad to answer any other questions you have as well. So they have my contact.
Awesome. And then Dr. Hill Moses, anything you'd like to say in closing?
Yeah, I think definitely go spend some time if you're considering an Aspen office. Sometimes I think in school it's kind of like taboo to mention the words DSO. Um, so I think, just go in there with an open mind and see what it's really like. And if you guys have any questions, I'm happy to answer them as honestly as possible. So I wish you guys all the best luck and enjoy the rest of dental school that there's left for you. If you're in
Awesome.
dental.
Thank you guys. I'm going to share my screen so that way my contact info is up there. But I'm also going to be sending out an email tomorrow announcing who the winners were for the raffle that I was running. And I'm sure you guys knew about that, as well as whoever submitted the most questions. They'll also be receiving a gift card. But you guys will get an email from me. If you want to reach out to me, my cell phone's literally on the screen there. So shoot me a text if you have further questions or want to chat or whatever, but I'm also going to be emailing you guys tomorrow. So don't worry. If you guys didn't hear the whole recording, I'll be emailing the recording too if you want to revisit it or there's any information you want to pick through there. Again, Dr. Williams, Dr. Hill Moses, thank you guys for coming on. Great information you guys offered. We really appreciate it. And that's it. Everybody have a good night. Thank you
Thanks,
guys.
guys.
Take care.
Good night.